Welcome back to our channel, where we delve into fascinating topics in health and science. Today, we're exploring the relationship between breastfeeding and breast cancer risk. This topic is not only of scientific interest, but also holds significant implications for women's health worldwide. So, let's dive into the science behind this connection. Breastfeeding is a fundamental aspect of maternal care with extensive health benefits for both the mother and the child. Over recent decades, research has increasingly focused on its potential role in modifying breast cancer risk among women. This article aims to provide a comprehensive review of the current scientific evidence regarding the relationship between breastfeeding and breast cancer risk. We delve into various epidemiological studies, meta-analyses, and mechanistic insights to elucidate the complex interplay between lactation and breast cancer development. Breast cancer remains one of the most prevalent malignancies affecting women worldwide, accounting for a significant burden of morbidity and mortality. Despite advancements in early detection and treatment, identifying modifiable risk factors for breast cancer prevention remains a key priority. Breastfeeding, a natural and essential aspect of infant nutrition, has emerged as a potential protective factor against breast cancer. The biological mechanisms underlying this relationship are multifaceted and involve hormonal, immunological, and physiological changes associated with lactation. This review aims to synthesize the current evidence regarding breastfeeding and breast cancer risk, shedding light on its potential implications for public health strategies. Numerous epidemiological studies have investigated the association between breastfeeding and breast cancer risk, yielding heterogeneous findings. A meta-analysis by collaborative group on hormonal factors in breast cancer, involving 47 epidemiological studies, found that longer duration of breastfeeding was associated with a modest reduction in breast cancer risk, with a cumulative risk reduction of approximately 4.3% for every 12 months of breastfeeding. However, the magnitude of this protective effect varied depending on factors such as age at first birth, parity, and menopausal status. The protective effect of breastfeeding against breast cancer is thought to be mediated through multiple biological mechanisms. Prolonged lactation suppresses ovulation, thereby reducing lifetime exposure to endogenous estrogen, a known mitogen for breast epithelial cells. Furthermore, breastfeeding induces differentiation and maturation of mammary epithelial cells, leading to a more resilient breast tissue microenvironment. Additionally, breastfeeding promotes the apoptosis of damaged cells and inhibits angiogenesis, processes crucial for tumor initiation and progression. Prolactin, the primary hormone responsible for lactation, exerts inhibitory effects on estrogen synthesis and signaling, thereby attenuating the proliferative stimuli on breast tissue. Moreover, breastfeeding leads to a transient increase in oxytocin levels, facilitating uterine involution and reducing the risk of estrogen-driven proliferative changes in breast tissue. Breastfeeding stimulates the production of immune factors such as secretory immunoglobulin A, SIGA, and lactoferrin, which confer protection against infectious agents and inhibit inflammation within the breast tissue. Chronic inflammation has been implicated in breast carcinogenesis, making the immunomodulatory effects of breastfeeding particularly relevant in cancer prevention. Promoting breastfeeding as a modifiable lifestyle factor for breast cancer prevention holds significant public health implications. Health education initiatives aimed at raising awareness about the protective effects of breastfeeding on maternal health could potentially reduce breast cancer incidence. Additionally, policies supporting breastfeeding-friendly environments in workplaces and communities are crucial for enabling women to sustain breastfeeding practices. In conclusion, breastfeeding exerts a multifaceted influence on breast cancer risk, encompassing hormonal, immunological, and physiological mechanisms. While epidemiological evidence consistently supports a modest reduction in breast cancer risk with longer duration of breastfeeding, further research is warranted to elucidate the nuances of this relationship. Integrating breastfeeding promotion into comprehensive cancer prevention strategies could contribute to reducing the global burden of breast cancer and improving maternal and child health outcomes.